The trauma bay at Grayson Memorial had seen its share of chaos, but nothing like the storm that walked in at 2:47 a.m. A pileup on the interstate had sent 4 critical patients through the doors within minutes of each other, and the night shift was already stretched thin before the second ambulance even screeched to a halt outside. Nurses shouted vitals across the room. Monitors beeped in a chorus of urgency. And in the middle of it all stood Dr. Elena Cross, a trauma surgeon who had transferred to the hospital only 3 months earlier, quiet, precise, and almost invisible until moments like this one. The patient on her table was bleeding out from a crushed chest cavity, his blood pressure crashing by the second. 2 other surgeons had already glanced at his chart and shaken their heads, muttering that he wouldn't make it to the OR. Elena didn't have time to argue with them. She grabbed a scalpel, called for suction, and began a procedure that made the senior resident beside her freeze mid-motion. It wasn't the standard thoracotomy technique, taught at any accredited program in the state. It was faster, more aggressive, and involved a sequence of clamping and controlled bleeding management that looked almost surgical in its brutality, like something designed not for a hospital, but for a battlefield. Within 4 minutes, the bleeding was controlled. Within 11, the patient was stable enough to move to the OR for definitive repair. The room went silent except for the steady beep of a heart monitor that, moments earlier, had been flatlining toward disaster. Nurses stared. The resident who had frozen finally exhaled. And standing in the doorway, arms crossed, was Dr. Marcus Whitfield, the hospital's chief of surgery, a man renowned for training half the surgeons in the state and tolerating exactly 0 deviation from protocol. He had watched the entire thing from the observation window. He'd seen the clamp placement that shouldn't have worked. He'd seen the timing that defied every textbook he had ever taught from. And he had seen his newest attending physician move with the calm, brutal efficiency of someone who had done this before, not in a simulation lab, not in a residency program, but somewhere real, somewhere with stakes far higher than a hospital malpractice review. He waited until the patient was wheeled out, and the room had quieted before he crossed the floor toward her, his voice cutting through the residual adrenaline like a blade. "Dr. Cross." A word. It wasn't a request. Elena peeled off her bloody gloves, dropped them in the biohazard bin, and followed him into the small consultation room off the trauma bay, the one usually reserved for delivering bad news to families. This time, the bad news might be for her. Whitfield didn't sit. He stood by the door, arms still crossed, studying her the way he studied a diagnosis that didn't add up. "That wasn't a technique I've ever seen used in a civilian trauma bay," he said. "That wasn't a technique I've ever seen used, period. The clamp sequence, the way you controlled bleeding before addressing the actual wound, that's not something they teach in any surgical residency in this country." He paused, letting the silence stretch, the kind of silence he used on residents when he wanted them to fill it with the truth. "So I'm going to ask you directly, and I expect a straight answer. Who taught you that procedure?" Elena had known this moment would come eventually. She had hoped it would take longer, that she could blend into civilian medicine a little longer before someone sharp enough noticed the cracks in her cover story. But Whitfield wasn't just sharp. He was the sharpest surgeon she had worked with since leaving the service, and there was no lying to a man who had spent 30 years reading bodies and the people who cut into them. She looked at him for a long moment, weighing exactly how much of the truth she was allowed to give. Then quietly, almost too quietly for him to hear over the hum of the fluorescent lights, she said 2 words that would change everything he thought he knew about her. "Task Force 160. Whitfield's arms slowly uncrossed. His expression, usually a mask of clinical detachment, shifted into something unreadable, part recognition, part disbelief. He had heard the name before, whispered in circles that didn't officially exist, referenced in classified briefings he had once consulted on during his years as a battlefield trauma advisor decades earlier. The Night Stalkers, the Army's elite Special Operations Aviation Regiment, the ones who flew the missions no one talked about, carrying operators and medics into places that weren't supposed to have American boots on the ground. "That's not possible," he said, though his voice had lost its certainty. "Task force medics don't end up in civilian trauma bays. They don't just show up with a new name and a clean record." Elena's jaw tightened. That's exactly what happens when the record isn't supposed to exist in the first place. The room fell into a heavy silence. The kind that comes when two people realize the conversation they're having is far bigger than either of them anticipated. Whitfield studied her face again, this time not looking for a liar, but looking for the person underneath 3 months of quiet competence and carefully guarded distance. "How many tours?" he finally asked. "Enough," she said. "That I stopped counting the exact number and started counting the men I brought home instead of the ones I didn't." Whitfield exhaled slowly, running a hand through his gray hair, the weight of the moment settling over him. In 30 years he had trained hundreds of surgeons. He had never once trained anyone who had learned trauma medicine at 40,000 feet in a blacked-out helicopter, under fire, with no backup and no room for error. "Why hide it?" he asked. Elena's eyes flicked toward the door, toward the trauma bay where a man was alive because of a technique that shouldn't have existed outside a classified operations manual. "Because the moment people know what I actually am," she said, "they stop seeing a surgeon. They start seeing a weapon." Whitfield said nothing for a long moment. Then, for the first time since she'd started at Grayson Memorial, he offered her something that wasn't suspicion or scrutiny. It was respect. "That patient is alive because of what you just did," he said. "Whatever you learned out there, wherever it came from, it just saved a man's life in my hospital." He turned toward the door, pausing with his hand on the frame. "This conversation isn't over, Dr. Cross. But it's not the conversation I thought it was going to be." As he walked out, Elena stood alone in the small room, the adrenaline finally draining from her system, replaced by something heavier. The secret she had carried for years had just cracked open in front of the one man sharp enough to notice, and she had no idea yet whether that crack would destroy the life she'd built, or finally let her stop hiding who she really was. By morning, word had already begun to spread through the hospital in the way rumors always do, quietly at first, then impossible to contain. Nurses who had witnessed the procedure whispered about the new trauma surgeon, who moved like she'd done battlefield medicine before. Residents speculated about her background, some guessing military, others guessing something stranger. None of them had the full picture, and Elena intended to keep it that way for as long as possible, even though she now understood that Whitfield wouldn't let this go without answers. He found her in the surgeon's lounge just after 7 a.m., holding a cup of coffee she hadn't actually touched, staring at nothing in particular. He closed the door behind him, giving them privacy the thin hospital walls rarely allowed. "I did some reading last night," he said, settling into the chair across from her. "Task Force 160 doesn't officially maintain surgical staff. Their medics are trained in trauma stabilization, but nothing at the level of what I watched you perform. So either the regiment's capabilities have evolved far beyond public knowledge, or you were something more specialized than a standard flight medic." Elena's grip on the coffee cup tightened slightly. Whitfield wasn't just perceptive, he was relentless, the same quality that had made him one of the best surgeons in the region. She realized then that half-truths wouldn't satisfy him. He needed enough of the real story to understand what he was actually looking at, without her crossing lines that could put people still in the field at risk. "I wasn't a flight medic," she said finally. "I was attached to a joint special operations surgical team. Small units, forward deployed, embedded with task force elements in locations that don't appear on any official deployment record. We operated in conditions that would make most trauma surgeons in this country walk out of the room. No sterile field. No backup team. Sometimes no lights except what we carried ourselves." Whitfield leaned forward, his expression a mixture of awe and something closer to grief, the recognition of what that kind of work costs a person. "How long?" he asked. 6 years, Elena said. "For deployments. I lost count of the operators I treated in the field versus the ones I lost in transit, because counting made it worse, not better." She finally looked up at him, her eyes carrying the particular exhaustion of someone who had seen more death in a single deployment than most surgeons see in a career. "When I came home the last time, I didn't know how to be a civilian surgeon anymore. Everything here felt too slow, too careful, too safe. I requested a discharge, changed my focus to trauma medicine in the civilian sector, and told myself the transition would eventually feel normal." Whitfield absorbed this in silence for a moment. "Does it?" he asked. "Some days," she admitted. "Other days I still feel like I'm waiting for the sound of rotors." He sat back, processing everything she had revealed, understanding now why her file had been so sparse when she'd first applied, why her references had been unusually vague despite glowing praise, why she carried herself with the quiet vigilance of someone who had learned that danger doesn't always announce itself. "The technique you used last night," he said. "The clamp sequence. That's not something you can put in a textbook, is it?" "No," she said. "It's something you learn when the standard method takes 6 minutes and you only have 2. When failure doesn't mean a bad outcome report. It means someone doesn't go home to their family." Whitfield nodded slowly and something shifted in his posture. The shift of a man reconsidering everything he thought he understood about excellence, about training, about what it actually meant to be prepared for the worst day of someone's life. "I want you to start training our surgical residents in trauma stabilization techniques," he said suddenly. Elena blinked, caught off guard by the abrupt turn. "Sir, some of what I know isn't exactly conventional." "I'm aware," Whitfield said. "That's precisely why this hospital needs it. We lose patients in that trauma bay because our residents are trained for controlled environments, not chaos. You've spent years mastering the kind of chaos most surgeons never have to imagine. That's not a liability, Dr. Cross. That's the most valuable asset in this building." For the first time since the confrontation the night before, Elena felt something loosen in her chest, a tension she hadn't realized she'd been carrying since the moment she decided to leave the military behind and start over as someone ordinary. Someone unremarkable. She hadn't expected this hospital or this notoriously demanding chief surgeon to see her secret not as a scandal to be managed, but as a gift to be used. "There will be limits," she said carefully. "Certain details I can't share. Names, locations, specific operations. Some of what I know is still classified, and some of it should probably stay buried for reasons that have nothing to do with pride." "Understood," Whitfield said. "I'm not asking you to relive it. I'm asking you to teach it, in whatever form you're able to share it. Because last night a man is alive who statistically should not be. And I refuse to let that kind of skill walk these halls unused simply because the world isn't ready to know where it came from." Elena finally allowed herself a small, tired smile, the first genuine one anyone at Grayson Memorial had seen from her in 3 months. "Task force medics don't really do goodbyes," she said. "We just move to the next mission." Whitfield stood, extending his hand. "Then consider this your next one." As they shook hands, the early morning light spilled through the lounge window, illuminating a woman who had spent years hiding in plain sight, finally stepping, however cautiously, out of the shadows of a past few people would ever fully understand. The hospital didn't know it yet, but the culture of that trauma bay was about to change forever. Built on lessons learned not in classrooms, but in the unforgiving crucible of battlefield medicine, carried home by a surgeon who had never stopped fighting to save lives, whether the fight took place in a war zone or beneath the fluorescent lights of an emergency room. If this story gripped you, hit that subscribe button and turn on notifications, because stories like Elena's, the quiet ones hiding extraordinary pasts, are exactly what this channel is built to tell. And the next one is coming soon.